being able to schedule on the Friday group. So that's kind of where we're at for the timeline here. And then, what we did was we kind of made a little table so that people could, and we'll share this presentation with you guys too. So if you want to, use it in your presentations in your organizations as well. But basically what we did was make it so it's easy to look at. So you can see the eligible group who should get the vaccine. Here's the reasons for the booster that that CDC laid out for, risk increasing with age for those 65 and over, risk due to age and congregate setting for long-term care facilities, and then risk due to age and medical conditions for 50 to 64-year-olds. And then this 18 to 49-year-old group, and people 18 to 64-year-old group, CDC kind of left it pretty broad to say based on increased risk for COVID-19 exposure and transmission, and based on if an individual looks at their benefits and risk, to make that decision to allow people. So if you want to get the vaccine, you can based on your individual risk. And I think one of the things I heard Rochelle Walensky say was an example of a restaurant worker, should you get the vaccine? You're a 20-year-old male. And she was saying that looking at, for instance, well, if you're a 20-year-old restaurant worker and you work in a restaurant somewhere that the community is not highly vaccinated, and then the restaurant doesn't require masks, that maybe that person would consider their risk higher than if they were in an area that was highly vaccinated and people weren't, were wearing masks. So just kind of those kind of individual decisions for the May group. We put all the underlying medical conditions down here so that you can use it in your, your educational information as well. But the CDC link is here as well, and they kind of organized it by alphabetical order. And then the latest one that they added was substance use disorder. So I thought that was really helpful. And then the groups here are the high-risk occupational institutional setting groups. So this is also detailed previously by the CDC, those at increased risk for COVID-19 exposure and transmission, including frontline essential workers and healthcare workers as previously detailed. So first responders, education staff, food and agricultural workers, manufacturing workers, corrections, U.S. Postal Service, public transit workers, and grocery store workers. And so that is left to the individual to decide how much their exposure is. But those are the risk categories that CDC is recommending. Then there's another piece that we also wanted to share regarding how we wanted to message this was that it is confusing, right? The additional dose for those who are immune compromised is Pfizer and Moderna, and the booster is Pfizer only. And that's a lot of feedback we've been getting from the community, that it's been confusing to be trying to message that. So we think we just have to keep on messaging it. But right now it's just the Pfizer only to boost the immunity from waning antibodies from the vaccine. So that's what kind of we've been messaging to the community. And then, letting them know who qualifies, and then when you can get the shot, 6 months after the completed 2-dose Pfizer, which basically is a ton of people right now. It's everyone who got it from December through April. And then for the additional dose, just continuing to let people know that that's just additional shot for those who never mounted that effective immune response. And then getting the shot at least 28 days after the second shot. So hopefully you can use some of these slides. And then we also are making some slides that you can use in the community, some educational materials around that. So let's look at anticipated increase in the COVID-19 vaccine demand through the fall. This is some data. I don't know if Brianna's on the call, but she helped make a lot of these slides. The Pfizer second doses administered by month. So if you look at all the Pfizers, not just the people who are eligible, but everybody, you can see that like the overwhelming chunk of Pfizer vaccine was given, as all of you know, and thank you for giving those shots, was December through April. So 68.5% of doses were given. So now you can kind of see like, well, that's a lot of shots to give out. And there aren't as many of us out there doing mass vac sites. And so we're going to have to figure out how to have the capacity to give the shot. So we no longer have a supply issue. We're really going to have like a more capacity issue. Here's the Pfizer vaccination proportions before and after the federal pharmacy program. So here's all the blue is the Moderna and the orange is the Pfizer. So you can see that right now we won't be doing as much of the long-term care facilities because the majority of them are actually Moderna. Here's some up and coming. It's likely that these next populations will be authorized for COVID-19 vaccines soon. So just looking at, how we're gonna respond to this, kids 5 to 11, probably starting early November. Moderna boosters, we're not sure. These are just estimated eligibilities, looking at late October. J&J boosters, probably looking at the end of the year. Once again, we're not sure. And then Pfizer boosters, the second dose given after April, that will be eligible in November through February. So this is kind of what we're looking at in terms of numbers. The DOH booster plan now, I'm going to go over what we've been thinking. And so once again, unvaccinated people are still our priority. Many people are still not vaccinated and at risk. And we've been collecting a lot of data on racial and ethnic equity issues and also social vulnerability. And if you can see this piece here, you can see our Hispanic and Latino populations, even though we're 70% vaccinated in the whole state, over 70% fully vaccinated. For Hispanic and Latino, we're lagging by 20%, as well as African American. So I think we want to keep on working on recognizing that we still have a lot to do with the first doses. Also geographically, we also know in the Southeast, we're less vaccinated than the rest of the state. So just we still have that as our top priority at the Department of Health. And so as a result, we're always going to save a certain amount in the app for those priority first doses. Here's the eligible groups that we calculated. So thank you to our whole DOH team and especially Dr. Durham, who got all these numbers and ran these groups up. But basically the eligible doses who should get the vaccine, for unvaccinated, over 700,000 people. So first appointment available date is now. So just still trying to encourage that group. People over 65 years old. This is all from our data that we have been collecting. We have about 124,500 due now. So you can see there's a lot of people. There aren't that many in the long-term care facilities. And I don't know, Secretary Hotram from Aging and Long-Term Services is here, so she can correct me if I'm wrong on that number.
You are not wrong.
Oh, yeah, I'm not wrong, 50. Okay, that's great, thank you. And then 50 to 64-year-olds with underlying condition, that's about 70,000. And so right now, all those people are eligible, and they're eligible to go get their vaccines inside the app. They can self-schedule an appointment. So the next group, the group that may get the vaccine, we really wanted to prioritize the older people, because when we started this last year, as many of you know, older people had difficulty getting onto the app. We had to help a lot in terms of the call center. So we wanted to give people a 2-week period of time where they could actually go get doses and prioritize these shoulds first. And then starting on week 3, there will then be available slots for the 18 to 49-year-olds and 18 to 64-year-olds with high-risk occupational and in institutional setting group. So just so that people know, right now, anybody can schedule an appointment, but the only people who can actually get an appointment in the next 2 weeks inside our app is the should, prioritizing the should group. And that's kind of where we're asking your guys' help, is that we know that not everyone is in the app, but if we can, as a community, as a provider group, think about prioritizing this group. I know we're not going to turn anyone away who's in the May group, but just really encouraging people who are older to be able to get their vaccines first. The way we're doing this is that right now, those who are on the app can schedule through vaccinenewmexico.org. We're really encouraging people to talk to all of you guys as providers. We know you guys are the trusted people that people will be influenced by. So we're encouraging people to talk to their provider. They can schedule their vaccine appointment with either a provider or a pharmacy, or like through the vaccinenewmexico.org site. And Brianna was so awesome. She put the actual text message that you get in your phone or your computer here. And then you can schedule at the same time their flu shots. So all of you who are doing flu shots, if you could do COVID at the same time, I know that's a challenge, but that would be awesome if that's possible. And then here's just some help for scheduling. We are really encouraging people that if you can do it online, do it online. And then if you're older, you're having difficulty, then call our hotline. So this is the hotline. You can schedule until 8 p.m. Oh, sorry, I need to change that to 8 p.m. So thank you to RTS and also our call center team at the DOH. And everyone who helps. We're going to actually have call center hours from 8 to 8. We'll also have option 3 and 9 that can take callers directly to a Spanish speaker. But like I said, we really want to save this hotline for our older people who have difficulty getting onto internet or people who don't have internet capacity. So that's what we're trying to encourage. Like, please use the vaccinenewmexico.org. Save the hotline for the people who really need it. Next slide is just shows an example, or shows like in the last month, what's the percentage of vaccine providers who have given doses? And so pharmacy actually is 63.2%. So go pharmacies. Thank you for all you're doing. And then also thanks to everyone else who's still been giving vaccine doses. So IHS 3.3%. Hospitals, 9.9%. Thank you to federally qualified health centers at 6.5%. Our own public health department at 8.6%. Other clinics at 2.4%. And then private practices. Thanks for all of you guys giving it in your private practice at 6.1%. So what we're asking is that if any of you out there had been giving doses before and haven't, have not had demand, perhaps now is the time to sign up again if you want to help out with the vaccine sites. We're going to have redistribution Pfizer hub sites at all these locations. So we have them throughout the region. So thank you, Lorraine, from our Lorraine and Joelle from our DOH vaccine team for setting this up and putting these together. And so these are the locations and people you can contact if you need Pfizer. Also, there are vaccines, number of COVID vaccine registered providers, both those administering and those not administering, with total potential New Mexico providers, which is 656. So just looking at this, here you can see the total vaccine providers registered, and then the remainder all potential providers. So if any of you guys are out there, once again, if it's possible and you can become a provider, this is the time to do it because you can give your patients your boosters. We do have this site, which is our takecarenewmexico.org site for providers. There are provider calls hosted by RTS on Tuesdays and Thursdays. If you do want to, get onto the app, become a provider, we would love for that. Eventually, COVID-19 vaccines, like other vaccines, could be given in provider offices if you have the ability to do that, or if not, like link up with your local pharmacist. I know my friend Heather is on here and she's done that, so that she just says like, here, I really encourage you to get the vaccine. And then she has her local pharmacist. Appointment demand really is expected to be high throughout the fall. As you saw, the coming attractions, there's going to be more and more vaccine groups that are going to come online. So if you do have ability in your app right now, and Chris can talk more about this later, to update your appointment availability as far out as possible, that will give the people who are looking for vaccine appointments now that ability to schedule an appointment. And then obviously the timing is great. Right now we can get flu and COVID together. It's recommended you can get them in both arms, but if you're doing a drive-through, they said you could do it in the same arm if necessary, not in the same place, but in the same arm. So yeah, so thanks for doing that as providers. And then this is just the last one. What more can we do together? I mean, New Mexico, yay, like 70% fully vaccinated. We're leading the pack because of all of you and our work together. The primary doses, once again, let's continue to promote that. I know a lot of you guys are working in the community. You guys are the trusted voices to schedule those primary doses. We want to, once again, prioritize the should group for the next 2 weeks and then continuing on for the 65 plus and the 50 to 64 with underlying conditions. Make sure you have availability if you are using the app. And then we'll be having a weekly update on Tuesdays from 12 to 1 for the next few months, just so that people can have a forum. We do want to hear back from you. We want your comments, your feedback, so we can keep on figuring out how we can continue to support everybody here. And then Chris will have a weekly app update meeting from RTS from 12 to 1 on Thursdays. So yeah, so that's the update. And then we want to open it up. I'll turn it back over to Chris to moderate for questions and comments and feedback from the group. And thanks again for all you do.
Thank you, Laura. Before we open it up for some questions and discussion, I did want to review a little bit of the data for our planning purposes. Let me go ahead and share this screen here. Can you all see a map with some counties colored red, green, and purple?
Yes.
Yes.
Okay, great.
Now we can.
So we'll make this URL available to you all, but what we're trying to do is give you a little bit of insight into the data for your county in terms of how many folks are eligible to receive the booster versus how many appointments are currently in the system, so that we can gauge. So like, for example, if we just look at Bernalillo County, and I'll try to zoom in here a little bit, you'll see if you click on a county, you'll see boosters needed. We need 106,000 as of today. Right now, we only have 18,000 appointment slots available, which basically means for every appointment, we have 5.71 people that are eligible. So what does that mean? That means that as of today, we're underwater a little bit in terms of appointment availability. As this continues to go and as more and more folks become eligible, what we're hoping is that that appointment availability increases. So what we're asking you to do, especially if you're using the app, is to log in and make sure that you update your location details and your schedule in order to open up availability for these folks to schedule their appointments. Now, I did see some questions in the chat here regarding current scheduling. So the questions really revolve around, why isn't my location showing even though I have availability? What we've done is we've locked down the next 2 weeks only for individuals that should be vaccinated. And so that's individuals that are 50 plus with a chronic medical condition and individuals that are 65 years and older. So the next 2 weeks, we're really trying to save those booster appointment slots specifically for them because they are the most at risk. And Department of Health, feel free to jump in and clarify anything that I'm misstating or anything like that. After 2 weeks, it's basically open scheduling for the boosters. So if individuals are looking to schedule their booster to come in, and they're in the May category, the soonest that they will be able to schedule is 2 weeks out. Now that doesn't negate the fact that they can go to a local pharmacy or another provider that's not using the app and get their booster. But what we're really trying to do is emphasize the shoulds in this whole endeavor. So I hope that's clear. If a little bit more clarification needs to be brought to that, we can answer those questions in the Q&A. So what we've done is we've put together this mapping tool, which you'll be able to see your own community and see your booster availability, appointment availability versus how many folks are eligible. And you can change the date range here. If you also want to see the data broken down by the NMSIS data in terms of, we're going to have to change some of this up, but 6 months is the time frame versus our current capacity for individuals 55 years and older. You can update it and see essentially where our communities are staged versus how many appointment slots are available. So hopefully this tool will allow you a little bit of insights in terms of, do we need to stand up more capacity? Do we have the capacity to stand up more appointment capacity? That kind of thing. So we'll share this link to you all in a follow-up email, and hopefully it'll give you a little bit of insight in terms of your planning moving forward. Dr. Durham, Dr. Patajon, anything else you want me to hit on the data tool here?
Can you comment on the colors, Chris?
Yeah, yes. So the reds are, we need a lot more capacity in these areas. The yellows are doing okay. So you'll see, based upon our boosters needed in Taos, hopefully Bill Patton's on here and listening. We've got 659 currently for their capacity. So that's going to take us about 4 weeks, which is good, but it's not great. Whereas if you come over to like Rio Arriba, it's only 3 weeks with their current capacity. Purple is we don't have any in the application. We don't have any current appointments or capacity in the app, and we have 702 boosters. So we're assuming that those are going to be taken care of by providers outside of the app. Does that make sense?
Yeah, no, that
Okay.
does. And thanks so much for all the work that went into this. That's really helpful. And that's
Absolutely.
great.
The available appointments, Chris, these are ones that are in the app, correct?
Yes,
Yeah.
correct. That's the insight that we have.
And to clarify, the 1,900 for Rio Arriba County, that's 65 and older?
So based upon this map, I adjusted the age range here. This is 55 to 100. If we wanted to see 65 plus, you would just toggle over the little date range or the age range here and click update, and it'll update that based upon your audience. So if we wanted to see basically everybody 12 plus, you'll see it's not a really great looking projection. However, if we toggle it to our shoulds category, it's a little bit better of a story. So this was really meant to be flexible for you all to adjust different scenarios so that you guys can plan according to your own patient base.
That's really great. And I think this tool is so great because we're hoping that, between everybody here, we can try to figure out how to get more capacity, or if you can't get more capacity in your area, then let us know, because we still have our mobile teams going out throughout the state. We have 4 mobile teams, regional mobile teams. And then also we're going to be contracting for some additional mass vax capacity throughout the state in the larger population areas. So we do really, if you can update your information, then that would give us more ability to understand where to place things. And of course, for you guys to give us feedback on what we can do.
And I do also want to just put an asterisk next to this data. This data is our best attempt at projecting. It's not 100% by any stretch of the imagination. We sent out surveys. We're looking at the data from the vaccines in the past, all of that. But it's our best attempt to give you guys a picture of what's happening in your community so that you can plan accordingly. So please just keep that in mind as you're making your preparations.
Chris, I have a quick question.
Hey, Rita.
Is there a way to also check a box for chronic illness on this booster planning dashboard so we can see who's 50 and older with a chronic illness who would be in the should group?
So we can look at pulling that in here to the RTS projection and adding it here. So this is RTS data versus NMSIS data. I'm not sure the NMSIS data captures all of the chronic medical conditions, but we will come up with a solution to help filter based upon chronic medical conditions.
The RTS projection will automatically filter out people who are eligible for the booster because of a occupation. So the second group of Mays only shows up when the date is set past October 11th, but we can add a toggle in there as well, so you can see what that looks like with or without the May group.
And everybody, this is Corey Purcella. He is our lead developer on this app.
Hello.
Thank you, Corey.
Okay, so I'm going to go ahead and stop sharing and turn it back on over to you, Laura. Yeah, go ahead.
Yeah, and we also have the rest of our, awesome vaccine team here. So if there's a question I can't answer, there's other people on this team that can answer questions too.
So do you want to transition into the question and answer portion?
Yeah, for sure.
Okay, so I'll try and moderate this as best as I can. If you have a question, feel free to raise your hand, like Jeff Clark and Beverly Simpson have done. Otherwise, you can throw it in the chat. Dr. Durham, if you can help me monitor the chat, that would be super helpful. We'll try and get to all of these as quick as possible. So I'm going to go ahead and start with Jeff Clark. If you want to unmute and ask your question, go ahead, my man.
Yeah, thank you. And thanks to everybody for the presentation. I just have a couple of, I think, fairly short questions. So if an individual is in the May group and they walk into their PCP, then their PCP should give them the vaccine, should give them the booster. Is that correct?
Correct.
Okay.
Yes, absolutely.
Thank you. And you don't need the app if you go to your PCP, right? You just go in, if you walk in your PCP, the app doesn't matter. Is that correct?
Correct.
Correct. Some PCPs are using it, some are not, but most have a way of scheduling in the moment. Yeah.
Yeah, they're just taking care of it, right? Yeah. Okay. And then, yeah, I've got another question about the pharmacy. Just very quickly, that pharmacy 63% is interesting, but I don't need an answer right now, but it'd be interesting to just look at that over time. In other words, I got a nickel. The pharmacy did a larger number early on, and now that we're getting to the ones that need more conversation about the vaccine, is probably shifting over to PCPs. So
no, that's actually,
is that true?
That's actually not true.
Not true.
Yeah, early on, the pharmacies were at about a third of our total vaccines, and now they're at about 2/3. As hospitals have gone down, mainly, that's the big numbers that have changed. And I think primary care providers have stayed pretty small at around the 6% level,
Okay, thanks.
Thank you, Jeff.
One of the things, oh, sorry, go ahead.
Well, no, I was just going to say thank you and move on. But if you want to address that further, Laura, go for it.
Oh, no, we have been doing surveys and trying to understand some of the, behaviors of people for how they're getting vaccines. And one of the things that we did find was that a lot of people were convinced by their primary care provider to get the vaccine. So thanks for all of you out there, like telling because there were some people who were like, yeah, I had to talk to my provider like 3 times before I finally decided to get it. But I think, then they go to a pharmacy or they go somewhere else. They don't necessarily get it at their provider office. But you guys play such an important role to do that, to convince. Yeah.
Okay, I'm gonna call on Beverly Simpson. Do you have a question?
Yes, I do. And I'm not exactly sure if this is the correct venue for it, but it's about opportunities to expand the provider footprint here in Los Alamos County. As you know, you showed we're red, we are red, and I understand there's over 3,000 Pfizer vaccines to be given or boosters if individuals wish to have them by the end of October, and then the upcoming Moderna. So I don't know exactly who I should reach out to discuss how we could expand that footprint.
Dan, you want to take this?
Yeah, I'll take this. This is Dan Burke. Hi, Bev. If we look at this structurally, and Chris mentioned this on the app, we've got 4 months of people who got primary series that are all due, now in October. And it's a big surge of need at a time when we don't have the same kind of capacity we had in January, February, March, right? Because at that time, the hospitals were doing a lot of community vaccination and everybody was on deck that could do it. At this time, we've got, we're losing FEMA. I mean, there's a number of capacity issues that aren't as strong as they were back there. So, I mean, I don't think we can make promises that we can send a lot more capacity up to, Taos or Los Alamos or any place that's a little short. Now, at the same time, we are working with to bring on a contract for a contractor that's going to bring on turnkey services and provide mass vaccinations in the hubs of each public health region, as well as mobile services. So we're trying to beef it up as much as we can, but I'm going to have to counsel a little bit of patience. I just believe right now, especially at the beginning, when everybody wants it at the same time, there's going to be more demand than supply. I just think that's the reality.
Right. Sorry. So let me clarify. It wasn't about getting more resources up here.
Right.
It was actually DOH has been great. And I've been working with Jessica Yaka. And so we have plans for the Pfizer, not the Moderna at this point. And I know that's probably a month and a half down the line. But I know in the beginning of this outreach that some of the emergency managers were able to come on board as a provider. If they had the correct credentials. And so really that's the avenue that I would like to discuss.
Great. And
I think that would then going to our, really the help for that is on the Take Care NM website for providers that Dr. Parajon showed. And there is it's covid.vaccines@state.nm.us. But there's people taking calls and answering emails to help people become providers. So we've really staffed that up so that you can just ask questions, decide if it's right for you, and if it is, to move forward.
Okay, thank you.
Yeah.
Great. Okay, I am going to I'm going to call on John Reno. John, I'm assuming if you can unmute there, go ahead.
John Mastonin. So to be clear, no matter the risk, if they got the Moderna, they won't be eligible for a booster for perhaps 2 months, no matter the highest risk?
Correct. Now, I'm just going to make a little caveat on that, which keeps this conversation confusing. But the highest risk are probably those immune compromised, and the Moderna, we don't call it a booster, but an additional dose. So a third dose, if you're immune compromised, from Moderna is approved. But for this general booster recommendation, 6 months out, what we're sort of talking about right now, did not get even addressed by FDA this round.
Thank you.
unfortunately. So yeah, no matter, everyone in the nursing homes that got Moderna, no booster recommendation.
Thank you.
And just to piggyback on what Dr. Durham's saying, the reason we're going to bring back these weekly meetings is because so much is changing. So these will be good touch points to alert you all of any of the new information, any guidance that the department wants to share with you all. So we'll be sending the invites for Tuesdays for everybody, and then Thursdays simply for the folks using the app and updates in the app. Okay, I'm going to go ahead and call on Janice. Janice, are you there?
You want my, oh, hi. This is actually Tara sharing a screen with Janice.
Okay.
I'm with the mobile vaccine unit, and I have a question. I understand how to explain to people, that they need to wait 2 weeks after their first dose, and then they'll be 50% immunized, and then 2 weeks after their second dose. But I'm a little confused about what to say to someone after the booster. Do you still need to wait? Like, how much has your vaccine diminished after 6 months or 8 months? And then do you need to wait 2 more weeks? And then how much more will you have your immunity built up? It's a little confusing to me. I don't know how to tell that to people.
It
don't think there's good
is
data on that.
confusing. And
There's like a
so,
not good day.
let's see, to sort of break it down, how much does immunity wane, I think was part of your question. And again, we've got, some of the studies out of Israel that seem to have numbers as dire as 40%. And then, we've seen numbers, I think what commonly gets stated in the US is kind of 80%. This doesn't even take, so some of that is real world data. Some of it is measuring antibodies and seeing how much they've gone down, which doesn't necessarily, not a functional number. So, and I'm definitely not an expert in this, but, I think it is confusing, and I think you're probably safe, and I'll let, others on the team chime in or on the call, probably in that 80%. Then I would also go with, I'd still stick with the 2 weeks at, whatever benefit you're going to get from your booster, I'd give it 2 weeks, just like we have, partly to be consistent, partly we don't really know. But I think that's a fair bet, 2 weeks for your body to, respond to the vaccine. Are those, and how much more benefit? I mean, I think that is one of the interesting things in this conversation. At least right now, there's no change in recommendation for if you've gotten your booster, now you can take off your mask. I mean, there's no recommendation like that. It's get your booster and still keep masking in every high risk, do everything that you were doing before to mitigate Delta spread. Others on the team, yeah.
Yeah, can I just share a slide? Because I think it might be helpful, but I'm not sure if I can share, if you can make me co-host. But there is some data, and this is why there was so much controversy, right? And why it was so confusing about the booster doses, was because they didn't have a lot of good data to work off of. And so I think that's part of it, but I just did want to share, oh, whoops, I guess I can't share, is just to share some of the data. Oh, okay.
You should be good, yeah.
Okay, great. Let me just share this. It's just an interesting slide. I thought that would be helpful, and we can send you these slides as well. But this is the data that shows, and I think, Tara, probably the best message is to keep on sharing with people how effective the vaccine is against hospitalizations and death, right? So when you do look at real life data, the Moderna, the Pfizer, and the Janssen are all really effective. So I still think the message should be hey, actually those first and second doses is what we want to keep on doing to prevent, you're 10 times more likely to get hospitalized or die if you don't get this. And so here's the Moderna that they looked at. This is an MMWR article, and it shows the vaccine effectiveness against COVID hospitalization for Moderna. Even after 120 days after full vaccination, it's 92% effectiveness. With the Pfizer, it goes down, it starts at 88, then 88 overall, 91%, 14 to 120 days after full vaccination, and then greater than 120 days, it's at 77%. And so that's maybe, that's part of kind of the data that they use to make some of these decisions. The J&J is 71% overall, and then over at 68% for greater than 28 days after full vaccination. But, basically it's just showing how effective the vaccines are, and that some of these decisions were really hard decisions. I think that scientific community of the ACIP had to make. Yeah, that's why the other ones are May, because we're just not really clear how much more effective that is. Yeah.
Okay, Laura, if you could make me a host again.
Oh, sorry. Yes.
No problem.
Sorry about that.
And Chris, maybe real quick before, because we got a lot of questions, but there's some questions in the app. How long will the chat, or in the chat, how long will the chat be available? Can we sort of send out the Q&A from the chat after? And for everyone who asked to be added to the list, yes, we will add you.
Correct. And we will, if we don't get to your question today, we will compile it, answer the questions, and then send it out to the folks that were on the email list here. And then also provide a contact to ask additional questions.
And that contact, if people want to start using the app but haven't, there are a couple of those questions in the app as well.
Yes. So I'll go ahead and put some of that in the chat as we call on Jody to ask her next question.
Hey, thanks, Chris. It's interesting to look at the map and the anticipated demand, but I have probably 1,500 appointments available in the next week. And despite that anticipated demand, I probably have 1,480 still open. So it's kind of tough to staff and plan these events, but then not have anybody put into those appointments. So just a little concerned that there's only this advertisement or push out to the 65 and up group, and wonder how we can address that. So that
Jody, that's a really, really great concern. So and if the operations team wants to take this, I'll just give a little intro, and then if you guys want to take it and run with it, will that work? Okay, so we haven't actively been pushing text messages to folks that are eligible. The first text messages went out this morning to individuals that are 65 plus that are in the should categories to start scheduling. What we did before all of this to gauge interest was we sent out a text message to 10,000 people in the eligible pool to basically see whether or not folks were going to fill the spots or not. Of those 10,000, we had basically 66% that responded. And of that 66%, mid-90s said that yes, they were going to schedule. So we know that the appetite's there. What we're trying to do is not overwhelm the system initially while we don't have the appointments. So what we're looking at doing is retooling the Fill My Request event in the section so that we can use the precision messaging tool in order to get folks within an area that has appointment slots available to those spots, but not overwhelm the statewide and communities that don't have those appointments. I hope that makes sense. DOH operations, do you have anything else to add to that? Okay, Jody, I hope that was clear enough. If you have any other needs for details, just let us know.
I'll just add, that kind of feedback is, I think part of this is going to be kind of the communication back and forth on sort of too much, not enough, because the app does really help with, or has the ability to somewhat control messaging. So, it just opened yesterday. It seems like you guys have gotten really good response, but if we need to step it up and send more messages, that's good information to have.
And I've also just put in the chat the link to request access to the app. So if you're looking to start using it, the request access is available in the chat. Dominique, do you want to go ahead and ask your question?
Hi, Chris. Yes, thank you. So I just had a question looking back at the map. I seen that Colfax was in purple, but we do have locations open, and they are active.
And do you have which locations are we talking?
The Raton Convention Center. We have Tuesday and Thursday open for next week, for a total of 900 for next week. And we have had some people who do qualify, but they're not able to get into some of the locations.
Okay. So I'm going to make a note of this and give you a call after I look into this a little bit. And
thank you.
Can I grab your email real quick?
Yeah. Do you want me to just put it in the chat?
That would be super helpful. Thank you so much.
All right.
And I just shared my the PowerPoint here so that people can download it off the chat, but Chris will also send it out.
Correct. Camila Gallegos, would you like to ask your question? Camila, are you there? Okay, we'll move on to Tanya Lawton. Hey, Tanya Corrales, how's it going?
Hi, Chris. Good. How are you? Thank
Good,
you
I'm
for
doing
all your
well.
help, by the way. I have a question and then a statement. My question is I've got like 7 events in this next 5 days coming up. If I do not fill them and I have an open vial with 4, am I allowed to give the mays instead of the shoulds? I see a yes from Miranda. Okay.
Yes.
Sorry,
Hi.
Dr. Durham.
So yes, I mean, there's really, while we're saying prioritize the shoulds, a lot of that is coming from the scheduling app and making sure that there's availability ongoing for the shoulds to find appointments, but absolutely fill events and let the mays come in.
And I am reaching out to all of my early December, January, very elderly population that didn't even know how to call you guys and have already started pulling them in. Some of them are actually registered under my email because they had no email or anything. So I've been pulling those in since yesterday. My comment is on the app. So my fire chief is a May. He could be a should because he used to be a smoker, but he doesn't have that marked. He's a May. He can go in right now and schedule at several locations on the app. But my location does not show up on the app for that. It's really weird. I just had opened him up and I could put him in at several spots if he wanted an appointment. So I don't know if that's part of what some of us providers are having not filling. We're not showing up on everyone's when they go into that portal. And I know I emailed you on that earlier. Chris,
Yeah, Tanya, let me take a look at it, and maybe what we can do is just jump on a quick Teams this afternoon, just so I can see the specific use case.
Okay.
And if there is a bug in the system, hopefully this will help identify it. But
I've gotten a couple people in the shoulds that have called me and said, why don't you have any spots open in Corrales? And I'm like, I do, but it's not showing up for them either.
Okay. Also, on Thursday, we're going to review this. I won't go into too much detail because we have non-app users on this call as well. But we're going to review your vaccine permissions as well, because in the app we have initial, second shot, booster, and additional doses. So we want to make sure that the settings are correct. But Tanya, I'll give you a call and we'll look at it and investigate a little bit further. So we'll go through that this afternoon. Okay, Camila, are you there, Camila Gallegos? Okay. We have about 3 minutes left. I'm looking. There are a number of questions here in the chat that I don't think we're going to be able to get to within this hour, but we'll save the chat. We'll answer the questions and then get back to you. A number of folks requesting to be added to the listserv. We'll make sure that we add those folks. And then Dr. Patahon, Dan, Dr. Durham, Lorraine, would you guys like to say anything to close out the meeting?
Yeah, go ahead. I'll start, but it's a whole team that's supporting. So thanks everybody. Thanks to our team and thanks to all of you for joining in and being part of this. So thank you. I don't know if Dan or Miranda, Lorraine want to share any parting words.
Just the same, I want to say thank you to everyone for everything that you've done for the people of New Mexico. And we encourage you to sign up to become providers if you're not already. I've posted the link several times and I have staff ready and able to help you through it. So just reach out to us.
Okay, with that, I just echo everything everyone's saying. This is a massive team effort. You all have done incredible, insane work under insane circumstances. So we're just very, very grateful for everything that you're doing. This link that you have will be the link to use for next Tuesday. We'll obviously send out the reminder and everything, but if you have this link, go ahead and save it. And then we'll address the Thursday meeting. This will be a weekly cadence meeting. Once again, we're hoping that this will be a good touch point for you all to bring any questions, concerns that you have to the Department of Health, and the Department of Health will be able to reiterate any guidance, new information that's coming from the CDC, Governor's Office, whoever it may be, in terms of operational nuances. With that being said, I think we can close it out. And we'll see you all next week. Thank you very much, everybody. Bye-bye.
Thank you.
Hey, Chris, this is Jody. Are you still on?
Yeah. Hey, Jody.
So we have our FEMA team's calling right now and they're trying to add the lot number. When you click on lots, it just spins and spins and spins. We can't add a lot, kind of like a light gray screen and just a circle going around and around.
Yeah. Can you go ahead and so we started, well, I'm going to let folks
go away.
Yeah. Well, I'm not sure if DOH is ready to announce some of this stuff, but
Chris, real quick, how can I have access to the chat to write up some answers?
yes. Do you not have?
How do I do? I mean, I can see it now, but if I close out of the meeting.
Oh yeah, I saved the chat. I'll forward it to you. I believe it's just saved in a notepad.
Okay.
Okay, cool.
All right,
I'll send it to you.
Chris, it looks like it's happening on all sites.
Let me see. Hey, Jody, I'm going to send you a Teams meeting and we'll just jump on that Teams meeting. Okay.
Okay.
Is that okay?
Yeah.
Okay. We'll jump on that Teams meeting.
You want to come over here?